Hi, Dr. Bill here. Good to have you here with us this evening. Those of you that already know our office, we're happy to have you participate. We do ask our patients to participate in at least one of these workshops a month so that you can learn new things and create a new person. So what we're going to talk about tonight, salutogenic approach to health. You may not know what that means, and that's what we're going to talk about. We're hoping that you will worry less and know more. Basically what it means is that it's looking more at the host than it is at the pathogen. It was developed by a man by the name of Aaron Antonovsky, professor of medical sociology, studied at Hebrew University and then went over to Jerusalem itself and studied a lot of post World War II Holocaust survivors and found a lot of things that showed that the host was so important under the most extreme of times. So we're going to talk about some things that are pertinent to your health and how you can do something about it, how you can make a difference in your own health, and what are some things that you can start with even tonight. So, Dr. McCoy is a well-researched chiropractor, and he talked about the robustness of the immune system and the immune system response. One of the challenges in our current COVID situation is we are so germophobic that we are taking away some of the natural ways that our body can respond to and react to normal pathogens that are out there that are part of our everyday life. There are germs in every room that you're in. In this room in my office, even though we have it cleaned on a regular basis, there are germs here. In your home, on the streets. So they're part of our lives. And when we over-isolate ourselves, we actually weaken our immune system. And that's one reason why getting outside, being active is so important. So we're going to talk about what are some things you can do right now. I said we're going to do this, and so we're going to do this. So take a quick analysis of what you're doing on all these areas. How can you improve your nutrition? What is it that you can do differently, better? Is breakfast the meal that you have the biggest challenge with? Is lunch the biggest challenge? Is dinner? Or our snacks? Most all of us that are honest immediately know, I really am terrible at snacks. I just have these horrible things in the middle of the day. Or dinner, I skip, or I eat too much, or I eat too late. Breakfast, whatever it might be, pay some attention to that, make some decisions. Don't change everything all at once because that's harder and then you're less likely to stay with it. But change one or two things at a time. Water is a really easy thing. This is my slide here, leave soda behind. I probably have soda maybe once a year, maybe once every 2 years, maybe once every 10 years. I'm a water guy, and I have my water bottle with me right now. 30 ounces, I drink at least 3 to 4 of these a day. Talking about it makes me thirsty, excuse me. And filtered water, not just out of the tap, but filtered water, whether you get that at a store or whether you have filters at home, whatever the case might be. Water is huge. You should drink at least half your body weight in ounces every day. It's basically free, especially if you have a filter at home or at work or wherever. You're not spending any money. You get the container and then you drink water. Pretty simple. You can spice it up with a lime or lemon or something like that, but drink lots of water. Exercise. Not asking you to go crazy about this, but you need to be doing something. Minimum of 3 days a week, you need to be doing some kind of cardio activity. If it's just walking around the block, if it's running, if it's biking, if it's swimming, if it's hiking, whatever it might be, you just need to be active. And the more active you are, the more happy your body's going to be, and you're going to build up your immune system. Mindfulness, meditation, stillness. We don't talk a whole lot about that in our society. At least a lot of us don't talk about it much. Huge part of calming the body down, taking time for yourself. Sleep is huge. We had a whole workshop on that a few weeks ago. You need 7 to 8 hours of sleep a night if you're an adult. If you're a teenager, you need more. If you're a baby, they're sleeping 12 to 20 hours a day. And anywhere in between, We have a pediatric workshop that we have once a quarter. In fact, we need to get a hold of her again soon to have her come in and talk about the different stages from 0 to 3 of sleep. Sleep is huge. Get a good mattress, get a good pillow, sleep in a cooler room, have it be dark, have it be sweet music if you need it, or soft noise. Do things that can help you sleep. Vitamin intake, C, D, elderberry, apple cider vinegar, all those things help boost your immune system. Very big deal. Okay, gonna look at this sort of again. One of the ways to maintain sanity while you're not as social as you could be is doing all these things. We suggest taking a walk, exercising, yoga, meditation, mindfulness, and prayer. You can do that at home. Journaling. Daily Pages, a book by Julia Cameron that she wrote a long time ago that's called The Artist's Way. Talked about daily journaling and just dumping out first thing in the morning and just having a free flow. Gardening is awesome. My wife has an awesome garden this year. We had a cucumber from it last night. We had zucchini from it. Minimize your exposure to the media. Boy, that's for sure. When I get depressed, turn on the news for a few minutes or hours. Reading uplifting books, listen to music, visit your family chiropractor, of course. So, those are good things you can do. How to work out, you can do it at home. You can do it anywhere. I prefer working out at home. A lot of people like working out at the gym, and I like being outside. So, you guys figure out what it is that you need to do or want to do. Dr. Dana tips. So, here you go. Dr. Dana is going to promote this. We did this a few months ago. We're going to do it again. We are going to give away 1 month of fitness coaching, $150 value. Carrie Hennessy is the person who does it. She is a professional bodybuilder, has competed in many competitions. You just take one look at her and you say, yeah, this young lady knows something very good about it. So it's both nutritional and exercise. So by making a comment, you get entered in our raffle. If only one person makes a comment, that person automatically wins. If a bunch do, then we'll take a look at them and see. And the comment would be, why do you want a month of fitness coaching? How would it benefit you? Why you think that would be important at this point in your life? All right, now we're going to keep on going. That which you persist in doing, this is a quote from Ralph Waldo Emerson that I've loved all my life, becomes easier, not that the nature of the task becomes easier, but that our ability to do so is increased. That's true with water intake, with sleep, with nutrition, with all those things. If you just keep doing it, it becomes more natural and more easy, and your ability increases. Okay, we're going to skip through this. We're going to get back to that later. We are now going to talk about vital needs. That's what the name of this workshop is. So, when you look at what is it that the body needs the most, we're looking at 4 things. We're going to start off with food. Food's very important. We already talked about that. How long can a person live without food? Well, there's a bunch of different things on it. More than a week or so, and you're definitely hurting. Mahatma Gandhi proved that you could do it 21 days by starvation, planned on his own. Not that you're not being fed anything, but something he chose to do himself. But obviously food gives us energy, helps our body function. So you can live for a while, but not that long. About a week, maybe 2 weeks tops, then you're hurting. You need to have food. Okay, take another look. Water. What about water? How long could you live without water? Well, it's less. Some studies it's 3 to 4 days, so somewhere around 100 hours. 60% of the adult body is made of water. It's water, H2O. The O is oxygen. Body needs oxygen. We get oxygen from water, hydrogen. So, direct connection of not having enough water to headaches, to dizziness, to organ dysfunction, to joint dysfunction, to you name it. And again, we'll go back to that. Very, very important. And these things that are in water are very important. So, take a look at that. 60%, 70% of our body is made of water. Our brain is even more. I think it's 80 to 90% of our brain is composed of water. So it does all these things. You already knew a lot of them. You can't do without water. But you could live for 100 hours without it. And then after that, things are going to start to go dramatically downhill and not survive. Okay, oxygen. We're going in incremental order, as you can see. A week or two, 100 hours, oxygen. How long can you live without oxygen? Go underwater and you'll find out. Not very long. Even though I did just see a documentary on people that can go 3 to 4 to 5 minutes and go to amazing depths, but they're trained to do that. Typical person isn't going to last very long. Minutes tops. A lot of us after 10 seconds are going to feel like, oh my gosh, I got to have more air. So this is what it actually is. In 1 minute, brain cells start to die. After 3 minutes, serious brain damage is likely. 10 minutes, many brain cells have died. Patient is unlikely to recover. 15 minutes, that's it. So not very long. So we had food, we had water. We now are talking about oxygen. What's the one that you can live with the least? That is nerve flow. This is the chiropractic office. We talk about nerve flow all the time. We're talking about the nervous system, not just aches and pains, which are definitely important and something that we definitely want to talk about and help you with, but we're also talking about nerve flow. Brain flow from the body, the brain down to the body. I'm going to grab one little poster real quick. Hang on. This is one of my favorite posters. Any of you that are patients here have seen this. Brain connected to the body. The brain ain't working, the body ain't working. And it shows that it's all connected, all the organs of the body. And you know that if you get paralyzed, then the rest of the body doesn't work. And if you get damaged enough, then it's over. Life force ends. So, how long can you go without nerve flow? Well, not very long. Seconds is what the answer is. We talk about the seconds from the brain flow down. If you don't have that, then you obviously can die. If you're paralyzed and that spinal cord is injured, then that part of the body down doesn't function the way it should. We're going to talk for a couple minutes about subluxations. We seem to always talk about subluxations, but that's our thing. That's our specialty. That's what we look for. That's what we can help from a baby up to a teenager, adult, all the way up to old age. We can help people with subluxations. A normal nerve, nice and fat and juicy, happy, disc is happy, blood flow is happy. Over here we got problems. We got pressure on the nerve, we got pressure on the blood vessel, we got pressure in the back and the front, not good. So we're decreasing nerve flow, affecting the way the body can function, and that's not good. Another view of the same thing, normal, not normal. Pressure on that nerve, pressure on that disc, and it definitely can have a direct impact on how the body works. So, if you want your body to function the way it's supposed to, the better the nerve flow, the better. You need some help with the nerve flow. The food, water, and oxygen you can do on your own. The nerve flow, you need to see a chiropractor. We are here to help people with nerve flow. I've told this story many times, but it's my story, and so I'm going to tell it again. And that is, I didn't know, but as a kid, I did lots of physical things, played lots of sports, fell out of trees. My brother helped me fall out of a 2-story garage. And yes, I landed on my head, which explains a lot of things probably. Anyway, my stomach wasn't working right. I always had too much acid in my stomach. Call it stomach acidity, call it heartburn, call it stomach acidity, stomach burn, whatever. I always had a problem. And through my teenage years, I had it, got into my early 20s, decided to become a chiropractor, did not actually have pain in my back, but I said, you know what, this subluxation thing kind of makes sense. I'm going to get checked. Probably don't have any, but I'm going to get checked anyway. Lo and behold, I did have some, my neck, my mid-back, and a little lower back, but the big one was here. When he touched it, I said, oh, I didn't know that was tender. He adjusted me, and sure enough, within 2 weeks, my stomach acidity of 10 years went away. That is brain-body connection. That's the nerve flow thing. I was still surviving, I was alive, but I was living at less of a level of health than I could be. So, that is what we check on everybody. Had a baby come in today who has reflux and constipation. Had an adult come in who'd been in a car accident. Have had multiple people come in for all kinds of reasons. One woman's hearing came back. Another sinuses have cleared up. Headaches have gone away. All by helping that nerve flow work better in the body, and that's what we're after. So, have any questions, let us know. once again, leave a comment, and you are eligible then for a month of fitness from both nutrition and exercise level. We are happy to talk to you and answer any questions you might have. We're here to help. So once again, quick review of vital needs. We're going to go back to food, do something about that. Water, do something about that. Oxygen, keep breathing, keep getting more oxygen by exercise, and finding nerve flow, come see us. Thanks for listening. Dr. Bill saying goodnight.